for today, well, welcome back everyone to our new series of our Connecting People and Community meetings. For those that don't know me, my name is Blair. I'm one of the senior practice consultants with the team. Helen, my counterpart, is just away today, but we have Kate, our project coordinator, and then Alexandra is our research coordinator, who will actually be doing the presentation on the well-being of underserved populations in rural communities. And that's looking at the focus groups we conducted with other populations across Alberta, and she'll be sharing those results and kind of some outcomes. So we'll also share a couple of resources, and then just a reminder that our next meeting will be October 22nd, 10 to 11, and that one there'll be a presentation from Hinton FCS Protect Your Assets. So before I pass it over to Alexandra, I'll just give a bit of background if those of you that may be new to the new to the team or new to the work that we're doing. This portion that we'll be talking about today is considered the scale activity of our Connecting People and Community for Living Well initiative. So it did start. I'll share the model here. Sorry. So this is, we had a grant from 2020 to 2023, and the work done during that time was really very much rural focused and working with 5 communities across the province, and really to explore building and sustaining individual and collective well-being in each of those communities, focusing on persons living with dementia, their carers, and multi-sector community teams that they may interact with. So it was through the creation of this model that you see here, this guided the work. And then there was also applied research that was done in that first grant that led to the creation of a couple of our tools, such as a well-being guide and competency framework. We do have another grant. So from last year, April 2023 to March 2026, we were fortunate to have another grant doing the same work. So we're continuing to work with those 4 original communities, looking at persons living with dementia and their carers and the teams, and then also spreading it to new communities across the province. And then what we'll be talking about more today is the scale portion. So that's looking at other underserved populations and seeing if the model applies. So just a brief overview of the model you see here that really guides our work. So the whole initiative looks at the strengths and assets of what enhances well-being for multi-sector teams in rural communities to better support those that live there. So the premise is being that when there's that collective well-being is supported, then they're better able to support individuals that reside in those communities. And so one of the components is provincial support. So that includes both our team of the Connecting People and Community, but it's beyond us to also broader provincial organizations and services that play an instrumental role in supporting this type of work. There's the communities advancing local work. So this is looking at or emphasizing the lived experience of those at the local level. So those with considering the experts of the diverse needs of what they might be experiencing, having their input and involvement. There's 10 core principles that we've come up with, and we consider these kind of the touchstone to guide the work that both us as a provincial team as well as the community teams use to kind of determine next steps and what impacts the work. There's a well-being guide, as mentioned. So this is a tool or a resource that was developed based on the research from the previous grant. And this measures and monitors the impact of the work, and each team works through it. And then a competency framework. So this outlines the skills and knowledge to work collaboratively with teams, but then we're putting some more work into that this year, looking at doing a bit of an assessment as a tool to share with our teams that we're working with. So I'll pass it over to Alexandra to share her work, but any questions before doing that? And if not, that's fine. Feel free to put in the chat or anything, but I will let Alexandra take over now.
I guess good morning, everyone. I'm Alexandra Timchuk, and thank you for the introduction, Blair. So as Blair mentioned, for the 2023 to the 2026 grant, we are interested in scaling up that model to other populations, and in this case, underserved populations within rural communities of Alberta. In order to define underserved populations, we referred to the definition that was provided by the Health Equity and Policy Lab in the University of Pennsylvania. And according to their definition, underserved populations are those individuals within a population that may face discrimination or any sorts of barriers, such as you can see here, financial, racial, gender barriers that impede their access to meeting their public health needs or any health services. To further our understanding of what underserved populations exist here in Alberta, we did a literature review. So we did a grade literature scan as well as an academic literature search. And then we also had numerous discussions with interested communities throughout Alberta to understand what potential underserved populations exist here in Alberta. There we go. So from that, we were able to work with 4 interested communities all throughout Alberta, and we were able to work with 4 different underserved populations. So one of those were individuals who are low income or housing insecure. Another population was older adults, 60 plus, living in rural communities. The third one was newcomers to rural communities, and also women who have experienced domestic violence. For data collection, as Blair mentioned, we did that also in the previous grant. We did focus group with each of these 4 different groups and populations. Those focus groups happened this year between April and June. Each focus group had about 4 to 10 participants, and all of the participants had to be 18 years of age or older, and they had to have lived experience, either previously lived experience or still going through those situations. So all of the focus groups and the research that we did was approved by the University of Alberta Ethics Board. And then in terms of data analysis, we did the same thing that took place in the previous grant. We referred back to Alistair McGregor's 2007 well-being model. And using that model, there's 3 different well-being domains that we coded the information under. So the first one is material well-being, which just refers to what things do individuals have that impact their well-being. So these could be material resources such as housing, food, transportation. It could also be the time and space, so the natural environment or the built environments in their communities, and also accessibility and inclusivity for them to participate in those communities. The other domain is relational well-being, which involves what relationships they have with different people and how that impacts their well-being. So this may include family, friends, but also any relationships through social engagement or relationships that impact their care. And then the last one is subjective well-being, which talks about how individuals feel about what they have and what they can do with what they have. So this really speaks to their psychological well-being and their psychological resources, their self-identity, and also their ability to handle any transitions. So now I'm just going to go quickly over the results that we heard from participants during these focus groups. So for these focus groups, we really wanted to understand and learn what impacts these individuals' well-being, and kind of from the material, subjective, and relational standpoint. And also just what is working well in their communities, what is lacking, maybe what is overlooked, what needs more focus. So in terms of individuals experiencing low income and housing insecurity, so some of the material things that they mentioned that impacts their well-being includes their outdoor built environments, so safe sidewalks to walk on in the wintertime, or accessible washrooms, benches, warming hubs. Transportation was another one, housing options, as well as different services. For example, grocery stores, or being able to access soup kitchens, and then also job opportunities to start their own businesses or to run their own businesses to make income. In terms of relational well-being, they mentioned the following relationships that impacted their well-being. So relationships with their family, relationships with service providers in their community, and also relationships with others who are also experiencing low income or housing insecurity. And then in terms of their subjective well-being, they talked about their perception of individual self, how they feel like they're not respected within the community, or they often feel like they are invisible in the community, as well as feelings of loneliness, isolation. And then in terms of overcoming different transitions in their life, a lot of participants talked about overcoming physical health changes and how that impacts their ability to make an income and to have jobs. The next population, older adults in rural communities. So in terms of material well-being, again, they talked about that outdoor and built environments. So having recreational facilities in the community gardens. They also talked about the need for transportation to move maybe to bigger urban centers for health needs or grocery needs, seniors housing and affordable housing, and then also service directory. So being able to know who to contact to help them with day-to-day needs such as lawn care or shoveling the snow or fence repairs or anything like that around the home. In terms of the relationships that impact their well-being, they talked about their relationship with local city council members, and then also relationships with others in the community through engaging in community events. In terms of their subjective well-being, a huge part of their identity is rooted in their length of residence in their rural communities, as well as their contributions to their communities. And then in terms of overcoming transitions, they talked about just adapting to the changing dynamics in their communities, the changing demographics, as well as the changing cost of living. Women who have experienced domestic violence with this group, in terms of the material well-being, we've heard about different safety measures. So being able to have access to private cell phones and to financial resources as well, or even safety measures within the community, such as QR codes put in washrooms that you can easily access and know who to contact and where to go. Also safe spaces in the community. So for example, they talked about grocery stores, being able to go to a grocery store and connect with other women, or having a safe space at work, affordable housing as well as women's shelter, and then also the legal system, having access to a lawyer, having access to restraining orders or any of those other coordinated resources, such as having materials on hand to know who to contact and where to go if anything happens. In terms of the relationships that impact their well-being, they talked about the relationship with their employers, with close friends, and also with service providers. These individuals are often able to help them with some of the legal aspects and also to help provide them with those safe spaces. And then they also talked about relationships within the community at large or through community engagement. So this includes having relationships with people on different committees, different boards, people on city council, different businesses or nonprofits who also want to make an impact in the community and address these issues. And then their subjective well-being is heavily rooted in their identity, in their relationships, and also the feelings of guilt and PTSD and trauma that they have to go through and overcome. And in terms of transitions, they go through quite complex transitions in terms of whether overcoming those legal aspects or any separation, divorce, and the families that may be involved as well. And then the last group, newcomers to rural communities. When we asked about what material things impact their well-being, they did talk about as well that initial housing options, transportation to and from the community for especially medical needs if they need to leave the rural community, other resources as well, especially things such as the internet or being able to access grocery stores within the community and that cost of living associated with that. And then also just the natural outdoor environment related to, for example, if they are not used to having so much wildlife around them. In some rural communities, there might be bears or other wild animals as well that might kind of impact the safety of them going out and doing what they want to do in the community. And then also spaces and activities for their children. So having accessibility to schools nearby and other recreational facilities for their children. In terms of the relationships that impact their well-being, they talked about their employers and their colleagues. A lot of them do come here because they are sponsored for their work. And then also relationships with friendships that they build over time in the community, and also the networks that they may build and establish with their own cultural or ethnic communities within the rural communities themselves. And then in terms of subjective well-being, they have to overcome that initial anxiety, stress of moving to a new country. They have to learn the norms here in Canada, all the rules and regulations that go here in Canada. But also there's that additional stress of having no familiar support or just not being familiar with anything and how it works here. And then one of the biggest transitions that they do overcome is those seasonal differences. A lot of individuals come from countries where they're not used to our winter or the weather. So that's one of the biggest things that may impact their subjective well-being. So even though we asked these participants, as I mentioned, what impacts their well-being, what's working in the communities, what's not, what is potentially overlooked and what needs more focus. We did hear from the participants as well, kind of the things that are already happening and what's being pushed forward. So for example, we've heard from individuals about their collective efforts to bring people together in order to increase their voices to be heard and also increase their advocacy power. There was another example shared by a participant about how they're already in communication with a specific organization and helping them to plan and implement specific programs that will help improve their well-being in the community. And a final very specific example of one individual who's working together to plan how to create a storefront where those who are within their underserved population can go and meet their material well-being needs. So kind of to conclude the presentation, there's three main themes that we drew from all of the populations, and these themes relate back to what impacts their well-being the most. So the first one's talking about the importance of building and maintaining relationships. That has a huge impact. Their overall relational well-being has a huge impact on their overall well-being as an individual. And then also another thing that impacts their well-being is their ability to have an active role in planning and implementing any supports in order to improve their situation. And finally, their opportunity to engage in different community activities, to meet new people, to network, but also to get to do the events or the activities that they deem valuable to do in a community. So that was a quick overview of the applied research that we did for this grant in terms of underserved populations. In terms of next steps, what we will be doing with this applied research is we will be similar to the first grant. We will be taking this information to modify our well-being guides in terms of in order to match these underserved populations. And those well-being guides will help the communities to be able to figure out what the priorities are in the community and what needs attention and what needs focus and what kind of next action steps could be taken in order to start improving the well-being of those individuals in their communities. And yeah, that's all I have from my end. Thank you guys for your attention, and I think now we can open up the floor for any questions.
Yeah, thank you for that, Alexandra. I'll just mention, Jay, you had asked in the chat, and Blair was talking to you if this research will be published. We do plan to put together a summary document just of all of these underserved populations, the 4 groups that we did focus groups with. So we will be sharing that on our website, also on Core Alberta. We don't have a definitive date for when this will be ready yet, because this is all really new, hot off the presses. You know, we just completed these sessions and the data analysis. So we're not quite at that point yet, but it'll be within the next couple of months, I expect. And I'll send that out via this mailing list as well, and we can make sure that everybody has access to that. So are there any questions or comments or? feel free just to take yourself off mute or use your little hand raisey emoji guy.
Just curious how many people participated in each focus group. You might have mentioned it, I might have missed it.
Yeah, so we had our one focus group had four participants, and the largest focus group had 10, and then the other two were around 8.
Awesome, thank you.
Go ahead, Jay.
Just want to clarify. So kind of like the next steps is that the research is going to guide a guide that then will be shareable to rural communities or other communities for next steps, or how to measure needs. Is that about right? It's kind of like a guide that's going to help communities take in the information for themselves. Sorry, I'm just wondering what the future next step is, a little bit clearer, if that's all right.
Yeah, so as similar to the first grant where we developed well-being guides for both persons living with dementia carers and their collaboratives, and those communities went over those well-being guides that helped them answer those questions like what impacts their well-being and what's happening in the community. And then they were able to use that information from the well-being guide in order to set different priorities, what they decided needs most attention, and from they developed action plans, and then those action plans turned into concrete deliverables that were happening within the community that directly impacted those individuals' well-being.
Thank you. That makes sense now.
Joan has a question in the chat. You mentioned seniors in rural areas identifying transportation as a barrier. Is that going to be addressed in these well-being guides?
Yes, for sure. And so it's one of the reasons why we do these well-being guides, in addition to also a literature review, is to understand what those main aspects that impact the well-being of those individuals in those community. And transportation, as you saw, it came across the board for pretty much every single one of those groups. And so that will definitely be in the well-being guide.
And just to add to that is the well-being guides, the way they're created, as if you recall, there's that graph of the different domains. So transportation being a material, what we consider under a material well-being, it's one of a question that encapsulates that, as well as other maybe housing care needs. So it might not be a question specific to transportation in and of itself, but it is asked or noted in the material section. And then from that, communities, when they are, or the teams, when they're completing the well-being guide, if that's something that really stands out as that priority in their community or a barrier that really does impact the individuals, then that's something they can look at exploring further, as Alexandra said, as being maybe that priority that they want to address or move forward with, how they can work to better support the people that live there. Just for a bit of idea of how kind of the well-being guide is structured. But we are still creating the new ones for these underserved populations. So still a work in progress.
I have a question.
Yeah.
I was wondering, with these focus groups, did they all sample people in the same community, or were these diverse communities across the province? I only ask because not every rural community is the same, right? We all have different supports in place, different needs, different demographics. So I'm just curious about that.
Do you want to answer that, Alexandra?
Sure. Yeah. So each focus group was in a different community. We had one in Northern Alberta, Southern Alberta, Central. So yeah, each focus group was a different community within Alberta.
And the communities, when we work with them, they had that option to kind of what population they might have wanted to focus on. So they identified within their own area that they noticed or felt was the population maybe with most need, or really present, because they could have continued that spread component working with individuals with dementia and carers, or like from the research Alexandra did, it was like really whatever you might be seeing, what what's the need there. So very much recognizing that, yeah, what might be in one community doesn't or may not be the same in somewhere else.
Okay, thank you.
Yeah, though I'll add to that, we are hoping when we create the wellbeing guides that they'll be based off the literature reviews and the focus group outcomes, but that they will be usable or feasible for any community that might have someone, say older adults as a focus group, that regardless of where they are in the province, they'd be able to use this wellbeing guide. So that's why they're just like with that transportation question, they're kind of, it's lumped into the different domains so that it can be answered directly, but it might not be a focus in one community as it is in another. Thanks. Other questions or comments?
Besides transportation, were there any other factors, or were there any other kinds of contributors to well-being that were kind of universal across all the groups, or a lot of the focus groups kind of shared? And how did they maybe address them when they were speaking about them?
So another one I would say under the material one was definitely housing. So housing definitely came up, whether it's initial housing for those newcomers or seniors housing or affordable housing for those who are low income. And then also women's shelter and affordable housing for women experiencing domestic violence. So that was definitely one that was across the board for all four of them. Another one I think was the built environment as well. So talking about, and it varied for different populations. For example, for those who are housing secure, low income, they were more concerned about having access to public washrooms and warming hubs, whereas for other populations such as older adults or newcomers, it was mostly to do with recreational facilities and green spaces. But that was also another one that kind of appeared across all four, but they varied in terms of what specific populations were most interested in, or what impacted those populations the most.
And if people do have questions, feel free to reach out after or when Kate sends out the information. Can contact us if anything comes up.
Yeah, definitely.
Oh.
I do see there's a question from Caroline in the chat. Was there a theme in transportation that was more prevalent? Cost, distance, accessibility, type of, for people with disabilities or what have you? Was there something that came out?
I think for all the groups, since we were focused on individuals in rural communities, I think distance was definitely one. There are different needs, for example, especially healthcare needs where they would need to go into a larger urban center. And so getting transportation to those larger urban centers, sometimes there wasn't any transportation available at all for other individuals. It was the cost of it to be able to go from a rural town to a larger center like Edmonton or Calgary. The cost was definitely a factor as well. So I would say definitely the distance, but also the cost as well.
Okay, also in the chat, Kathleen is saying, I was late joining this morning, so missed some of the introduction. Was there representation from Indigenous people in these focus groups?
I would say yes. There was definitely within each focus group, we only had the requirement that you had to be 18 years of age or older, or had to have lived experience or still living through those circumstances. But yes, we had participations from all different ethnic groups.
Yeah, if you missed the beginning of the presentation where we mentioned sort of who those groups, there were 4 focus groups held. One was with older adults in rural and remote communities. One was with newcomers to rural remote communities. One was women experiencing domestic violence, and the last one was people experiencing low income or housing insecurity. So those were the 4 focus groups. See any other questions or comments or observations from your own communities or? Oh, there's another question from Jay in the chat. Was there anything you found in your data collection that emerged that wasn't identified in your lit review?
Yeah, that's a great question. I would say, just looking back at the specific communities, I think a lot of those subjective well-being, what contributes to their subjective well-being and also the relational well-being, in terms of especially newcomers, how they talked about the importance of the relationship with their employers, with their colleagues, especially when they're just getting started in their community and learning how everything works. And then also looking at, for example, the older adults, how their identity is rooted in their communities, how long they've stayed in those communities, their length of residence, and then also those that discussion around those changing dynamics and how they're adapting to that, adapting to the cost of living, but also adapting to the changes in the demographics within their communities. Maybe the increased density within their communities as well. I would say that's not quite captured in the literature yet. Maybe it will be in the future, but that was definitely a newer finding as well. But for the most part, a lot of the literature that we did, the literature search that we did, it did confirm a lot of the findings that the participants did share with us.
From Andrew in the chat, what were some of the examples of initiatives that communities have put in place after use of the Wellbeing Guide in the previous phase?
Do you want me to answer this one, Alexandra? So for that, it's there were the 5 communities, and the hope was that each would do one initiative or action, and there actually had been 60 different outcomes or initiatives. So they really ranged depending on what the community had identified as a priority, but some examples were dementia sensory kits, there were pop-up day or pop-up programs, there were a day program was put in place. It was a lot of education or awareness, so it might have looked like maybe a community function or a community dinner, maybe having a speaker come in, sending out pamphlets or I guess like information packets. There was a lot of activities, so maybe like a fair, and then there was a focus on the dementia carers. It was a bit informal. There was connections to other services or grants to apply for a grant to receive that money to build something ongoing. There was, yeah, a lot of one community, I think they did kits, the sensory kits. There is working with intergenerational, so with high school, I believe it was high school students. They put together different sorts of activities that people could do, people living with dementia and their carers, and then having that connection with younger generations. There was, I wasn't here for the first grant, so I'm trying to think, but there was also dinners. I believe there is a community that kind of did like a community dinner. So, and some of them still have the creation of maybe like a further nonprofit, so like a coalition or a different sort of community team that's ongoing. So they're still spreading this work, still working, still continuing that a bit. And they might still be involved with us, but they do it with their own community teams, and they might have not been part of maybe the first grant initially, but they're still using kind of the model or the guide to continue the work. That's a test, Andrew. I wasn't prepared for this morning.
Thanks, Blair.
Yeah,
There
no
is a
problem.
question, another question from Jay. Is there any sources in the guide that might help ensure a successful project? She says, I see so many people access guides, but nothing comes to fruition or it struggles to meet goals.
Well, I would say with the first guide, it was based on research. So it was that instead of focus groups, what they had done as part of their applied research was had done interviews. The team did interviews with individuals with dementia, if they had that capacity, and their carers, as well as the different community teams, to kind of see what was working, what wasn't, what they would like to see, as well as doing literature reviews there. And they did, if I'm recalling correctly, they had initially done like broader scans of what exists and then trying to kind of compile that so that the guide is something that really tries to focus on those main points of well-being for a collaborative team and how they would try and be successful to support the well-being of individuals living with dementia and to support the well-being of carers. So it was based on research. So I don't feel that I'm sure there's references that they utilize, but I don't know if they're actually like in the well-being guide, because the well-being guide is available on our website, which we'll share shortly. But yeah, I'd have to go back and see on the website what resources are there. But if there was something particular that you were hoping to access or get more information on, we could look into that. I think with that, one point is the competency framework, which is part of our model, that has kind of those skills or capacities that really do support the work. What we're working on this year is the last grant, they had put together so different categories of what they see as the main skills. And then this year we're trying to create an assessment that we will share with the community teams, and hopefully it'll be on the website eventually. And from that, each kind of category does have resources that we have found or pulled together, or a consultant has on the team to really address that. So if there was something that, for like understanding well-being, what that might look like, how to really capture that. Oh, thank you, Kate. The website's in the chat. There are pieces to that we are able to share resources that have been found to be useful for teams to work together to better support well-being. I'm not sure if that totally answers the question and what you're looking for, but oh, no, good. Hope we're doing the best we can. So hopefully they're being resolved. Other questions or?
Yeah, Leah, I see that you mentioned about Barhead and the Harvest Supper in October. In a second, I'll just open up a slide just about other resources and stuff to share, and then maybe we can, invite people to mention any other things that are happening in their own communities in a sec. But are there any more questions or comments about sort of our applied research or these focus groups or today's presentation? Okay, let's see, maybe Alexandra, do you still have the slides open?
I can pull that up, yeah.
Yeah, do you mind opening the resources slide? You just go to the next slide.
Yeah, it just seems to take some time to move over, but
Yeah. Well, we'll wait for the PowerPoint to catch up. But there is one event that we wanted to announce that's coming up in Innisfail community. So if you're in Innisfail on, oh, perfect, now it's up. On October 3rd, sort of all day at the Innisfail Public Library, the Innisfail Community Partners in Action, and that's one of the teams that was participating in our grant from 2020 to 2023, and their participation is ongoing. They're having an event called The Weirder the Mix, the Better the Fix. So join us at the Innisfail Public Library, where Community Partners in Action will showcase the community partnerships that support people to live and age well in their community. And this is really an event to encourage people, anybody who wants to be involved in this kind of work, to come out, learn a little bit more about the collaborative and how they can become involved in Innisfail. So I'm not sure if we have anyone from Innisfail joining us today. If you want to say anything extra, feel free to pipe in and promote your event. They do ask that you register. It's both in person at the library. You can also join virtually. There's an Eventbrite link to register for that, and I will send that out in the follow-up email, and I can try and put it in the chat right now. But if anybody is from Innisfail and wants to talk a little bit more about that, feel free right now.
Hi, Kate. It's Dixie McLeod here.
Thanks, Dixie.
Yeah, no, if anyone is close by or wants to join in, that would be fabulous. We would, like Kate mentioned, there's a registration link there, and we are hoping to send final numbers for our caterer kind of by the end of tomorrow. And so, if possible, if you want to attend, if you could register right away, that would be great. But it's looking to be kind of a fantastic day with a multitude of speakers and partners, and should just be a great event.
Great, thank you, Dixie. And Leah, you had mentioned in Barhead the Harvest Suffer in October with Lorraine Mills from Alzheimer First Link. Do you want to jump in and promote that a little bit, or if there's a link you want to add to the chat?
Hi. Yeah, no, we don't have any links or anything to put into the chat. We've got Lorraine coming out. We're going to have it at our Barthead Senior Drop-In Center. And just to, bring caregivers and care partners and some of our community members together and just give them a little bit more information and awareness education and stuff on what we're seeing in Barhead as well with some of our community members. So
that's great. Thanks, Leah.
Yeah.
Alexandra, there is one more comment in the chat from Sandy Lyons from Lethbridge. Says, I'm new to this space and back in January. I've been a chartered professional accountant, licensed insolvency trustee for most of my career, and I'm becoming more involved with seniors in transition of care and accessing financial benefits to meet needs. And he's wondering, to what extent was this considered with the seniors group that you talked to?
So in terms of accessing financial needs, there was discussion around, as we mentioned, having those relationship with the local council members and those service providers within the communities. There was a lot of discussion around being able to have your income tax done, or, for example, those seniors in rural communities, some of them do own agricultural land, so maybe financial needs surrounding that was mostly discussed. I would say that was the biggest one in terms of any financial needs that are surrounded in terms of them owning any agricultural land, or in terms of getting any senior benefits, getting their income tax done. Those were the main things that were discussed. I hope that answers your question.
I think that with that, like with this particular focus group, if it hadn't come up as a big need or gap, like the transportation, it's still kind of part of it, one of the larger questions, recognizing that it is still an issue that greatly impacts well-being. So, as Alexandra mentioned, the accessing benefits or whatnot, it's included in one of the, I believe it's under material well-being. It is part of the questions that we're creating in the well-being guides. So it might be something specific a community really wants to focus on, but it may also be something that wasn't highlighted, but recognizing it obviously impacts every individual and every group that we worked with or are working with, their well-being. That financial piece is significant.
Okay, any other questions, comments, things you'd like to share about from your own communities, any new resources or anything you'd like to share? Feel free to introduce them, sort of take yourself off mute or pop it in the chat. I will send out any resources that you share with me in the follow-up email with the link to this presentation as well. So. All right, Alexandra, if you can just sort of blitz through those remaining slides. Again, here's our website. You can always get more information about our initiative on there. All of the recordings of these meetings are on a playlist on the Healthy Aging Alberta YouTube channel. I will send the link out in a follow-up email within the next week or so after this meeting. You can also find us on CORE Alberta. Join our group on CORE. And yeah, that's it. Invite your friends to our next meeting. It'll be October 22nd. Again, it's a presentation from help me, Blair, the Hinton FCSS on Protect Your Assets. So that's really focused on sort of scam prevention and that sort of thing, which is a big topic nowadays. So I think it'll be a really good presentation, and I hope you can join us next month. So yeah, thank you so much, everybody, for joining us and for the great discussion. Feel free to follow up in email with any other questions that you may still have. And yeah, we hope to see you in a month. So thank you, everyone.
Thank you, everyone. Take care.